Okay, here we go. I think we're setting it up for Facebook Live, or we're trying to connect.
Oh, the anticipation's killing me.
Okay, we are live on Facebook. Welcome everybody to our live Q&A with the Nerdy Girls. We have myself and 3 other nerdy girls here to answer your questions. And so I think I'm just going to start off with some introductions while we wait for people to connect. We are going to take questions from viewers. So just put your questions right in the comment box on this live Facebook Live thing, post, whatever it is we're looking at. And we will try and take as many of your questions as we can. So I'll start. My name is Malia Jones, and I study how diseases spread through populations of people at the University of Wisconsin-Madison. And I am also one of the nerdy girls who runs the Dear Pandemic Facebook page and Twitter feed and Instagram account. Amanda, do you want to introduce yourself?
Sure, I'm Amanda Simanek, and I am an associate professor of epidemiology at University of Wisconsin-Milwaukee. My training is in social epidemiology, but my focus is on how social factors influence infectious disease and the role of the immune system in linking social inequalities to health outcomes.
Great, thank you. Lindsay, you're the next up on my screen.
Great. Hi, I'm Lindsay Leininger. I'm a health policy researcher here at the Tuck School of Business at Dartmouth College, and I train leaders how to think about healthcare data.
Thank you. Alison?
Hi, I'm Alison Buttenheim. I'm an associate professor of nursing and health policy at the University of Pennsylvania. I don't really do nursing or health policy though. I study the behavioral aspects of infectious disease prevention.
Great, thank you. So we've got 4 of the 10 nerdy girls here, and I just want to highlight that we are all wearing our new Nerdy Girls t-shirts. Very nice.
Shout out to Mary Jo Valentino, a wonderfully talented graphic designer who designed these clothes.
Yeah, is helping us get some branding together, which is a little outside all of our wheelhouses. So we appreciate the assistance there. So we're going to start off with a couple of questions that got submitted in advance of the live chat here. But for those of you who are just joining us, put your questions in the comment bar, and I see a few comments coming in already, so I can tell that it's working. So awesome news. So one of the questions that we have gotten in a lot of different forms, a lot of different ways over the last week is we are seeing places starting to reopen. Here in Wisconsin, in Madison, Wisconsin, we're planning to go to a phased reopening, a stage of reopening, where we have a limited number of people allowed in one place on Tuesday morning. And so we are getting a lot of questions about that. And I know a lot of other places are also beginning to reopen. So let's talk about how do we think about this reopening process in light of the fact that we still don't have a vaccine and we won't for some time. So to make it a little more specific, Amanda, I know you tackled this question yesterday on the radio. So how do we think about safer socialization, safer being social for this holiday weekend and the beginning of summer?
Yeah, this is a big issue in Wisconsin. So I live in a different part of Wisconsin, in Milwaukee area, and we've already opened up in the suburbs over here. So we are moving from the safer at home order, as many states are, which was an effort to have a population level wide intervention that stopped transmission of infection. And now our state, as well as many others that are reopening, are moving to where we are going to have to sort of individually think about how we can reduce our risks of infection as we start to branch out into more social interactions. And so in many places, reopening is not really occurring because we met the metrics that we're supposed to, and particularly around building up our testing capacity and our contact tracing capacity, which is really what can supplant those kind of stay-at-home orders and what we need infrastructure-wise. So it's a good idea to be cautious as we re-enter. Just because things are available to us, doesn't mean we necessarily need to jump out and do them. We can be more strategic in how we sort of re-enter into activities and interactions. And so something that we talked about on Dear Pandemic on some of our posts was this idea of expanding our bubble. That's a good way to start. So if you have been isolating with people in your household, you might find another household that you can sort of join with and make a bigger bubble. And we talked about some of the things you want to think about. If you have children, this could be a way that, childcare centers and camps may not be available right away this summer, or if at all. So what are we going to do if we have to keep working from home? And how are we going to entertain our kids who are no longer doing distance learning? And can we just sustain what we've been doing for 2 months with, families trying to juggle all of that? Personally, I'm feeling a little intimidated by that idea. So I think, if you can find a family that you might link up with who has kids that are the same age as your kids, who have some of the same interests, and maybe make an arrangement where you sort of share childcare duties, that could be a great way to have a gentle re-entry and sort of start to expand your bubble. I think it will be important to set ground rules. So what does it really mean? Who else are you socializing with or not socializing with? Will you see grandparents? Will you, let all the neighborhood kids come over in the backyard and have popsicles? So you want to set those ground rules so there's no disappointment or confusion over what exactly you kind of are agreeing on, and you probably need to revisit them over time as well. And then as we start to build our interactions up, it's good to have a consistent group of people, better than a mixture of people that you start to interact with, right? Keeping it small and similar across days. And that, prevents some of the cross-pollination in our communities that we're worried about will lead to community transmission. And it makes it easier if for some reason someone in your bubble got exposed. It's much easier to recall who you were in contact with when a contact tracer calls you. So these are like some of the ways if we want to step out slowly and carefully, that's one option that we could consider.
Great, thank you. Yeah, we have been making plans within my family. A lot of the Nerdy Girls have young children or older children at home, or both. And so we all really feel for all the families out there who are trying to figure out how to make this work over the summer. And we personally, in my family, we have decided to forego camp and childcare, like a nanny kind of situation for the summer. We're just gonna try to make it work with a partner family. And so we are trying to negotiate. And I'll just say that I want to echo this idea that it needs to be very clear what the boundaries are of how wide that circle is going to get on both ends. And we have already faced a number of really awkward social situations. And I think that's something we all just need to be willing to have open communication about. And we've also agreed within our buddy families to just revisit it all the time, all the time. Oh, we accidentally, my kids ran over into my next door neighbor's yard. Are you concerned about this? And if so, what do you want to do next? And we literally just talk about it a lot. So
That'll be really key, I think.
Yeah. And it will continue to evolve constantly. So I think that ongoing communication is really important. Lindsay or Allison, anything you want to add here? This really is one of the most frequent questions we're getting.
I think to build on what Amanda said, I really like the small and similar rules, and then trying to think of one to add to emphasize the importance of being outdoors as much as possible. Maybe it's sunny, small, similar, and sunny.
Yeah. There you go. The 3 S's.
3 S's. And I think the other challenge, of course, is that everyone's going to be doing this in their own way. And so that idea of flexibility and constantly sort of renegotiating is really important, especially when, right now, as justice places are starting to open up in Philly, we're still a couple of weeks away from leaving the red zone. You see people outside kind of cheating, and it's hard to know sort of what to do when like other people aren't doing what they're supposed to do, and just remembering what we do and don't have control over in our lives, I think, is an important piece.
Agreed. 3 S's.
I like it. Yeah, or maybe 4, space, right? So even
Space.
Yeah,
Spacious.
space. Right.
still thinking about social distancing and even in those settings.
Well, I think Amanda's point too about, and I know Malia, you've been thinking about this, sort of keeping a running tab of where you've been and where your household members have been. Contact tracing hasn't gotten a lot of attention yet because a lot of cities and counties, haven't sort of stood it up to full capacity yet. But you're very likely to get a call from a contact tracer sometime in the next 6 months. And it's going to be helpful for you and really helpful for them if you can say, like, I don't have to guess where I've been. I don't have to give you a rough sense. Like, I actually know where I've been. And I can tell you that list and I can tell you who else was there.
One of the things that I would like to see come up more often in some of these reopening plans that I've been reading is keeping track of people who are together in group settings, especially when they're together repeatedly. So this contact tracing idea, it's a huge project. We've never done contact tracing at the scale that we're talking about doing it right. No one has ever done it at this scale. And I don't really think that state governments have the capacity to do it, especially reopening as early as we are. And so it's going to take our individual level involvement in that to make it a little easier and go more smoothly. So I really do want to see people keeping track of who they're in contact with, and group organizers like, the pool or the soccer club or your family pod or your daycare, keeping track of attendance in a really specific way, in a new and very specific way.
And Malia, can I sort of piggyback off of that? So one question I've been getting from my circle a bit, this is a strong word, but you'll get the spirit of it. It's kind of a nihilism about contact tracing. Like, there's no way we'll get 100,000 to 300,000 people able to do this. So one thing I really want to amplify right here and now is that contact tracing doesn't have to be complete for it to be effective. The way that it works with exponential math and epidemics is that even if contact tracing is incomplete, if you can cut off some of the nodes, you're still going to stop the spread. So I don't think we want to be nihilistic about this. Also, we know American ingenuity and we know the things that America can do when it puts its mind to it at big scale. So I agree, we're sort of at this critical juncture where the workforce is still getting stood up, but it does not have to be complete to be effective. So go contact tracing. We're big fans. Nerdy Girls.
Johns Hopkins released a free contact tracing course.
I took it.
How was it?
It's awesome.
Yeah, right. And it's free. Anyone could go on.
So Lindsay, tell us the highlights. What are you have a PhD in public health, so maybe you knew some of it already, but what were the top 3 things that you took away?
So my 2 favorite things were, one, it provides a whiz-bang overview of COVID and the virus SARS-CoV-2. So it is like a 101. And that's the first unit. It takes about an hour, and that alone is worth the price of admission, probably more because it's free. You get the point. So they've put together really nice visuals that explain things like the difference between the infectious period and the incubation period, and what the virus is, and how the virus got into humans. So again, I think it's a terrific 101 on the disease itself. I think the other thing I really appreciate about it, as someone who has trained community health workforces similar to contact training workforces in my past, is it focuses on the nuts and bolts of how to do this, right? How you make the call, how you trace the contacts. But most importantly, it really emphasizes the role of contact tracer as community builder and trust builder. So the idea is that this workforce helps people navigate the disease and the healthcare system and the exposure, even if it doesn't lead to disease. So contact tracers are really helpers. And so I hope that at their best, they will instill more trust in the system.
And for people who aren't working right now because of the pandemic, this is a job that pays $20 an hour in most places, and, a way to rally around being part of the community solution, I think. So it could be very beneficial to communities, I think, to wrap their minds around this.
Yeah, and if you're looking for just something to do and something new to learn, this free course, I've heard great things about it from Lindsay, who's not the first one who told me it's been great. So we got a question come in, talk a little bit more about wearing masks outside. And then there are a few other questions about outside. And so I want to talk about this. Is it necessary to wear a mask when going out for an early morning walk with few or no people around? Should we take one just in case? There's a related question. Is it safe to eat at a public picnic table? How about letting kids play at a playground? Is it okay to have a small party if the party's outside? So let's talk a little bit about being outside and wearing masks and how the virus is transmitted. Alison, you want to start off with that one?
Sure. So here's my take on masks, and I'm a behavioral scientist. So I spend a lot of time trying to think how to make behaviors that we want people to do really easy and almost mindless and habitual. And from that standpoint, it's just easier to say, when I walk out of the house, I have a mask on, and I keep it on unless I need to eat or something. Putting sort of decision rules in place where if the running path is a little crowded, I do wear it, I don't have to wear it. And then once it gets this much crowded, I do, or if I'm with a friend or not, or household members or not. So I think one of the ways masks are going to help is if it just becomes the norm, like we just take off our shoes before we go through screening at the airport. There's still science evolving about how much protection is it actually providing, how much respiratory droplets it's actually keeping on your side of the mask if you're sick, or outside the mask if you're not sick. But it's just going to have to be part of our kind of pandemic response individual behavior. And so for that reason, I like to just say, just wear a mask. When you leave the house, wear a mask. That's my take.
Great. Anyone else want to jump in on wearing masks outdoors? Or how about some of these other questions about just being outside, and what is different about being outside? Why are we even asking, do I need to wear a mask outside?
Yay, outside. Right? That was Alison's third of the S's, right?
Sunny. Yeah. So there's good evidence mounting from a lot of small studies that answer part of this question, but we're sort of accumulating evidence that just a lot less transmission is happening outside versus inside. Mm-hmm. That's both from studies that trace sort of clusters and how clusters emerge and where transmission happens, and then some other, just sort of knowledge of the virus and respiratory droplets. And it makes sense, if this is droplet borne, it's going to make sense that outside is going to be a safer spot. And combined with, fewer numbers of people and sort of closed networks and shorter duration exposure, it's just a really good way to keep that transmission down.
So related question to that, this is a very specific question, but does chlorine kill COVID-19? Anybody want to tackle that one?
Gosh, this seems like an early March question when we were figuring out how to buy cleaning supplies.
I know. So I've been working with my community pool extensively, so I'll tackle this one. I think the implication here is the pool okay, right?
Right.
There is no evidence at all that you can get COVID-19 through the water in a chlorinated pool. It's not really waterborne, and it's also not really foodborne. We've seen essentially very limited evidence of anyone getting sick by eating something that was contaminated.
Nor mosquito-borne.
Also,
we've gotten that question a lot. Yeah.
Oh, I haven't seen that one. How interesting.
Yeah.
Yeah. So
and no pet to human transmission, right?
No pet to human transmission. Although that literature seems to be evolving. Maybe we can come back
to
that.
Human to pet, I think we're seeing.
Yes.
So human to pet, we are starting to see some evidence, and I want to return to that because I want to return to this idea of uncertainty and how much we still don't know.
But answer the pool question, because we don't care about this one.
But we all care about the pool, and so I'm going to answer the pool question. So no, you're not going to get COVID-19 through the water swimming in your pool. In all likelihood, it would be very unusual circumstances for that to happen. But it is transmitted through the air, and doing activities that make you breathe hard will increase the risk of droplet transmission. And so exercising in a pool or in a gym or elsewhere will make you breathe harder. And so doing a group activity in the pool is questionable because, you don't breathe underwater, you breathe in the air.
Right. Or shouting or saying, hey,
yeah. So some of those high risk activities where we've seen super spreader events have been exercise singing, shouting. A lot of shouting, it turns out, is one of the reasons that we've had so much disease in the meat packing industry, is because it's very noisy environment, and the employees are shouting all the time to communicate.
And nightclubs.
Where it's also very noisy, and so people are yelling and they're very close together. So I do think that the pool itself is not the problem. It's that you need to be careful in the activities that you're engaging in at the pool, and you need to be physically distanced from people outside your household while you're at the pool. So that's the answer to the pool question.
And I think we can think of the challenges of lifeguards in those situations, and the challenges of, you know, enforcing those kind of distancing rules.
Right. In Wisconsin, and the CDC has also recommended that there be a social distancing monitor who is not the lifeguard, in order to not distract the lifeguard from what it is that they're doing. And
it's a great guideline.
Yeah, I think that's a smart guideline. So let's return to this idea of like, why don't we know some of the answers to these questions? And pets. I'm sure everyone
and
wants
pets,
to know about
always
pets, right? So we learned that cats and dogs probably too can become infected with SARS-CoV-2. Cats, we recently learned from a UW-Madison study, can actually transmit it from one cat to another cat. But they have to be in pretty close quarters for that to happen.
That was observed in a zoo, I think.
Yeah, like a zoo, or, you know, some kind of a very, like within a household, you can imagine that happening. And this is new information. We just learned this. So what's up with the, like, why don't we just say, oh yeah, cats can get it, or not?
Well, Malia, you've been great since, you know, early March again at saying this is a brand new virus for us, at least for humans. And you know, we didn't study it in mammals because we didn't know it was there. And there's a lot to learn. And even though the scientific output has been astonishing, those of us who've gotten requests to review scientific papers know that the output is large. There's lots to learn. There's lots to learn about transmission, about treatment, about public health measures.
And like at a basic level, you know, animals don't talk either. So it's really hard to elicit their contacts and, you know, figure out what their symptoms are.
Good point.
Right?
That is a good point.
So instead of chipping them, we need to put little GPS collars on our pets so we know where they've been.
Oh, like those badges that they sometimes use for workplace contact studies, where you, like, the badges get close to each other and they ping one another so you know who talked to who.
Yeah.
I was trying to cue you all up to just talk about this idea of uncertainty and why we're still not sure what.
Can I add
Just
something
tell
to
us
that?
what you want to say.
Yeah. Yes.
Can y'all hear me?
Yeah, Lindsay, go.
Okay. So uncertainty is here. It's with us. This is a new disease. We all have to become more comfortable with it, which is quite hard. I will say the uncertainty piece has my worry hat on. As I'm looking through Facebook Reels, as I'm sort of consuming information, uncertainty is being weaponized against expertise. And I have found that really disappointing, especially over the last week. Science will change. That doesn't mean there's a conspiracy theory, and that the fact that the scientists said something different 2 weeks ago means that they're doing some sort of mind control. So I think this like weaponization of uncertainty, it's got a nasty side to it. So I think we can just educate everyone around being really clear about the fact that even the best information is provisional, but some stuff's straight up wrong. So.
Right.
But I think there's been a related, skepticism about models. You know, it's easy to describe a model as they just made the numbers up, and you know, it's some ways that is an accurate description because the numbers aren't observed data; they are modeled data. But that doesn't mean that you can they are often helpful and point us to better decisions. But I saw that today, like this is a stupid model; they just made the numbers up.
Mm-hmm.
So we actually got a question that's related to this. Let's tackle this one. What are your recommendations for addressing misinformation when all of us see it on Facebook? Yeah, Lindsay.
Oh, Lindsay.
So I have 3 Lindsay's laws about this. And I'm forgetting the first, but I'll remember it, I'm sure. So that's where my brain is today. But the second is, the first is extraordinary claims require extraordinary measures, in the words of the great Carl Sagan, right? So he was a very famous scientist who's no longer with us. But basically, if somebody's coming out with something extraordinary, there better be a boatload of extraordinary evidence backing that up. So number 2 is be like Abraham Lincoln and assemble a team of rivals. Actively seek out competing viewpoints than what you're consuming. Triangulate, triangulate, triangulate. And the last, but certainly the not least, is get out there and amplify the good information. Focus more on that than debunking the bad. Debunking the bad sometimes works, but sometimes it has what's called a backfire effect, meaning you actually keep it in the news cycle unintentionally longer than it should be. So really part of our entire platform here at Dear Pandemic is amplifying the good stuff. We are big cheerleaders for good information. That's what we spread. And also, I'm just going to grab this and own it. We also really are working hard to amplify female expert voices. Because we think that their voices deserve amplification big time. So again, extraordinary claims, extraordinary measures. Be like Abraham Lincoln, assemble a team of rivals, triangulate your news sources, and last but not least, amplify the good.
Yes, thank you.
An example came to mind, that when we first started studying SARS-CoV-2, there was a study that came out looking in the lab setting how long it could last on surfaces, right?
Right.
We started from a point of zero knowledge about that, right? But a lot of the knowledge we first gain is in a lab setting, right? And then we have to wait to see how that translates to an applied setting in real people, right? And so, it takes time. There's steps to sort of learning about a new infection in different capacities before we understand completely how it acts in real life.
Yeah.
And so I want to, speaking of amplification, I want to amplify Amanda's point. And the way that I talk about this often is that we are fighting on 3 fronts: bench, bedside, broader population. And often the science sort of follows the same path, right? You learn things at the bench, then you learn it often in clinical settings, and then you see how it flies in the real world, right, in observational studies. So we're fighting this on 3 fronts. The information often starts at the bench first, and it takes a while to disseminate, change, evolve as it moves through to the broader society.
Yeah.
Although I'd say, interestingly, with this outbreak and a lot of infectious disease outbreaks, we're also innovating and experimenting at the population level. I mean, all these public, we're at Philadelphia. We're actually experimenting with different approaches to contact tracing to see, like, how do we get people to pick up the phone? What modality? Who should be calling? Should the number show in the phone? Is there a better time of day? And that's doing the science at the place where it's being.
At the population, yeah. And it is kind of all reinforcing too. I don't want to oversimplify and suggest that it's like lockstep. So thanks, Alison. That's an important prompt. They all reinforce each other.
So we've actually gotten a couple of questions about this idea of what's the latest on surface contamination and fomite transmission is what us nerds call it, is fomites. So Amanda, you want to give us an update on the latest?
Yeah, actually, like a reporter contacted me the other day. So now it's not a big deal on surfaces. Can you talk about this? And I said, can you send me a link to what you're talking about? And essentially it's not that it's irrelevant on surfaces, but our thinking about it has, been more, solidified, or now that we understand, like, yes, in the lab setting, it lasted on a cardboard for 24 hours or, whatever the duration was. And it's still considered like a mode of transmission, but what we're learning from studies that are using real life examples of outbreaks is that it really seems the droplet spread is the primary mode of transmission, right? And so these actions we can take around social distancing and wearing a mask are important, but we should still wash our hands and not touch our face in clean surfaces. But we shouldn't, but we're learning about whether it's necessary to wipe down all groceries or, the things that when we only had the lab evidence, we weren't exactly sure what to do. And that changes over time, right?
Yeah, it's a great example of how things evolve and how things in the real world are different from the way they are in the lab setting.
What do they say? Mice lie and monkeys exaggerate, or is it the other way around?
No, I think it's mice lie and monkeys exaggerate.
And monkeys exaggerate, right?
Yeah.
Oh, in terms of animal studies?
Yeah, in terms of animal model studies, that we can't always extrapolate direct
From the lab.
to interpret that. We can't always extrapolate directly from what's happening in the lab study to what's happening in when something is out in the real world. So yeah, what we've learned about surface transmission is that it's not the primary way that people really are getting infected. It's mostly this face-to-face droplet transmission. So there are a bunch of questions about school, and I want to turn to this theme. So, what is your best educated guess about what school will look like in the fall? And in this case, someone is asking about elementary school, but we've had some other questions about preschool. We've had some questions about summer camp, and I know there are parents out there who are wondering about college too. So what do we think?
Do you want to
Alison, I think this is
Yeah, let me jump in. So I've been fortunate enough to be part of conversations at 3 of those levels of educational institutions. So an elementary school, a K-12 school, and a college in terms of planning for next year. And I will say this is really hard. I mean, talk about moving targets, right? And what we're not getting yet is really clear guidance from states or from the CDC about how to do it. There's no manual from the CDC, and I know so far of only one state that has put out a manual for higher ed on like literally what do you have to do. And so schools and colleges are starting to plan, and what they're planning for is flexibility. I think every school and college recognizes that there is at least a pretty good chance, I don't know where to put it, it's different in different places, but it's not zero, that the whole fall, for example, could be remote again. Which I'm sorry if like everyone's stomach just dropped, but
or if it doesn't start remote, we need the
right.
flexibility to go remote.
Exactly. So whatever was like much more quickly put in place in March at schools, I think they're starting to recognize like, let's be a little bit more deliberate about, what that actually looks like so that it's an enriching, rewarding, experience for the kids of any age. At the same time, I think everyone is very keen to figure out how to do something in person. And that looks like tweaking the calendar, right? Can we get their kids there sooner and maybe they leave by Thanksgiving if it's a residential situation? But also the same idea that we were talking about for get-togethers this summer, small and what was the word for closed cohort? Similar. It's like the same networks.
Consistent.
That could work for schools too, right? So we're calling it radical cohorting in Philadelphia. Could we think about putting kids, and when I say kid, that's going to be a preschooler or a college freshman, in a group of 10, 20, maybe at colleges, maybe it's 40, and that group stays together all day, all term. You can immediately start thinking of all the problems here and the challenges. But if that group has a couple of teachers, the right ratio to get those kids schooling, that's a more likely way to sort of stay safe and stay open for more of the fall than any kind of schooling where the whole school gets together or kids are mixing around or specials teachers move from classroom to classroom. That helps limit transmission, and it really helps, as we've talked about with contact tracing, if there is an exposure or a case, ideally only that pod of kids maybe has to bump home for 2 weeks. What have you guys been hearing from your institutions?
Well, so I want to just elaborate on one point that you just made, which is this idea of radical cohorting, and the reason that would be an effective way to prevent to do outbreak control, right? So I've been talking a lot about, people keep asking me about the vaccine, and to be honest, the news about the vaccine is not great. It's going to take a while. It's going to take longer than you're hoping for. And
let's put a pin in that and come back to that conversation too.
We do need to talk about that too. And so people are like, okay, but what about herd immunity? Herd immunity is what I study. And I can tell you that is also not going to save us. Herd immunity is not the solution. So I think that leads people to be like, well, then what? What do we do? And what we have to do is this thing called outbreak control. outbreak control relies on us limiting the number of hosts that the disease can get to. And the best way to do that, the most effective way is these lockdowns that we've all been in for the last several weeks. That's not sustainable. And so the second best way to do it is to prevent those contact networks from getting really big. And so if you have a group of 50 kids and 6 teachers and they're exposed to just them in school each day, that's a lot better than the typical pattern, which is where all the kids, you know, you've got, in my son's 4th grade classroom, for example, they do co-teaching across 3 classrooms. So it's 75 kids and 3 teachers plus the specials teachers. And then, and they all mix all day long. And then at lunchtime, they go to the cafeteria with the entire school and spread germs among the, however many kids are in the whole school, 600 kids or whatever. That's a very big network. And then when you start to add in all their parents and all their siblings and all the schools their siblings go to, that's a very big contact network. So this idea of breaking the chains within that contact network, I think it's something people haven't had a lot of practice thinking about, but it's really important for doing outbreak control.
And may I offer another just thing about school too? Like, I think we think a lot about outbreak control. We think a lot about radical cohorting and safety and sort of the metrics and the methods to make this all safe. But we also appreciate and understand how important schools are to the fabric of our society. We are not being public health schools here, right? Like, we honor the importance of schools. We honor that often it's an equity issue, that vulnerable children need to be in school perhaps more than anyone else. So it's a very solution-focused conversation, I would say, which is heartening, right?
Good point, Lindsay.
Well, and it's a place that's going to need, I mean, for all the folks who are listening, if you can volunteer any skills, expertise, resources you have to your local public school districts or a local college or the college your kids go to help figure this out, do so, because they need even just, you know, some grunt work, some brains on creative solutions that will work with whatever guidance we end up getting from the state, and that can flex and be nimble as, you know, the new epidemiologic news sort of rolls in the fall.
And we can look to Europe and Asia. I mean, they have a jump on it.
They do. They do. We'll get some good learnings from all the places that have reopened in different ways.
Yeah. So let's return to the vaccine thing. What's the latest on the vaccine?
Malia, I got to hear your thoughts on this.
Yeah, I think you're our.
Yeah, I'm intrigued.
You're our nerdy on this.
Okay, so so vaccine development typically follows this this stepwise approach where we first evaluate the safety of a new candidate vaccine in a very small group of people. And then we go to a slightly bigger trial and evaluate the safety of the vaccine in a bigger group of people that's maybe a little more diverse. And then we do several more trials to make sure most of the trials that happen before a vaccine is released evaluate safety and not so much effectiveness of the vaccine. And they also usually proceed in order, which is why it takes so long to develop a new vaccine. You have to wait for the results of the phase 1 trials before you can move on to phase 2 trials. What we're seeing now is that the vaccine phases are being stacked. So we're doing phase 1 and phase 2 trials at the same time and trying to shorten the length of time until we get to vaccine. I don't really know that will get us to an effective vaccine much faster than normal. And this idea that a vaccine is going to be available by December or January, I think is extraordinarily optimistic. It would be revolutionary to develop a brand new vaccine in 18 months. And the idea that we could do this in 10 months, I think is very unrealistic. We really have to come up with outbreak control solutions that will be more durable and not count on a vaccine that is effective in the fall. Even if we did get a vaccine that was effective and safe in December, just manufacturing a vaccine for the number of people in the United States would take like 8 months. And so it wouldn't be available to all people, even if it were approved. And I don't think it'll be approved by then. So I'm really sorry. The science is moving very quickly on vaccines, but I don't think it's moving as quickly as we all hope.
Lindsay, do you want to give your pro innovation shout out?
Yeah.
So
Yeah.
Just so the people watching know, I am the resident sunny, optimistic, nerdy girl. So I feel like full disclosure. So I agree with everything Malia said, although I do have a piece of context to add maybe with respect to innovation. And one of the innovations we're really seeing is actually on the production front. So there is a new type of vaccine called mRNA that works on a completely different biological mechanism than the vaccines that we've come to know as a society. And if one of those new vaccine innovation candidates do end up demonstrating safety and efficacy, its production can be scaled quite fast. It just skips a lot of production steps. We have some preliminary evidence this week at the very first part of Malia's stepwise process. So we don't want to get overexcited, but it didn't fail. Which what Sanjay Gupta said, who was like, it didn't fail, it's going on to the next step.
Yeah.
And if this type of new vaccine ends up being the winner, it will be able to be scaled much more easily, cheaply. And the technology is pretty easily standardized and adaptable to other contexts too. So
I also agree with everything that you said, but I will add that this type of vaccine has never succeeded before.
That is correct.
And I think we can't put all our eggs in that basket. We
need many vaccines.
Yeah, we need many vaccines candidates to figure out which one is going to be the fastest, to get out to the general public and to be effective and safe. And we also need to plan on having to do this outbreak control nonsense for a long time. I mean that, I hope we don't have to do that, but we do have to plan on it. So,
even in the most optimistic scenario with a vaccine.
Even I think that outbreak control will be with us for a long time.
It'll take time to administer to people, even after produced, right?
Absolutely. And I have to have Alison
weigh in on the
put out no, Alison has a new analogy that came up with this week. Do you want me to paraphrase it? Or do you
I was going to add another wrinkle. I will go back to the analogy, but the other wrinkle as a behavioral scientist is people also have to be willing to get it once it's out. And there is some early survey evidence right now, but that's, getting us, who research this excited, that take up is not, we cannot take that for granted, that everyone will be like, woohoo, vaccine, bring it on. And we've seen some interesting intersections of the anti-vax movement and the sort of reopen too soon movement. And I fully expect that they will be out in force once we have a COVID vaccine that may depress take up below what we would want it to be.
So what I was starting to say is that I think it will be a combination of other mechanisms of outbreak control and get the vaccine out for quite some time. And that's the reality.
I think that, even since like the last time we did a live conversation, just in the past 2 weeks on many fronts, the conversation shifting from this kind of crisis moment that we were in sort of March and April to this realization, as you said, Amanda, that we're with this, we need these strategies for a long time, whether it's vaccine development, vaccine acceptance, outbreak control, social distancing. We all need to kind of learn how to live our lives and collectively run our society a little differently. For some number of years, probably.
So let's talk about we just got a question from someone who is a grandparent, thinking about the how long it's gonna, we're gonna have to be in this kind of cyclical outbreak control phase for a while, but certainly the rest of this year. Does that mean that they have to be isolated until a vaccine's available? Can they see their grandchildren? How safe is it to take a road trip of 4 hours to 2 days to go see your family members?
I can start to tackle that.
Please, Amanda.
Everybody wants to jump in, I'm sure. So I got asked this recently as well. And, I think one strategy that you can think about, right? Well, generally from here, we want to think about who is vulnerable in our families, who's older, who might have chronic health conditions going forward in the ways that we can protect them. Something that I think could be a reasonable strategy is if you want to visit grandparents, put your household on lockdown for 2 or 3 weeks, strict lockdown, and kind of try to reduce the likelihood that you are going to be a source of exposure when you see them. And then stick to those things we've been recommending, like get together outside, wear masks. When if you get together, don't share food and utensils. And, these same strategies that we can use in socializing with everybody, we definitely want to use when socializing with grandparents, right? And that those are some of the extra precautions that we can take, right? In terms of driving across the country, I think anybody driving across the country is going to have to think about where you have to stop and, use public restrooms and upping your hand washing, hand sanitizing during those trips. You guys, what else do you want to add?
Well, what about flying? I mean, I think we're getting
Yeah.
a lot of flying questions too.
I think that's the question.
Flying versus driving. I've gotten a number of questions on this theme of like, okay, I'm going to isolate for 2 weeks and then go see my parents this summer.
Can you add why that 2-week period is important, Malia? Because I didn't say that.
Oh yeah, so the 2-week period is important because we think that if you have been unknowingly exposed to COVID-19 and you could be incubating it, by the end of 2 weeks, even if you're asymptomatic, you are likely not shedding any virus anymore. So if you can lock down, do a personal lockdown for 2 weeks before you go see your parents or your grandparents or the high risk people in your life, then you can be pretty sure that you're not going to be bringing COVID-19 into their home. But you have to be careful you don't get it on the way to go see them.
Yes, so those other precautions I would still recommend.
Yeah,
Right.
so let's talk about this flying versus driving and how can we minimize our risk when we're going to have summer.
Right. We're hoping you're going to answer this for us, Malia.
I know.
Oh,
wait.
no, I'm the moderator. Allison, it's your turn. Actually, no, I want to hear from Lindsay on this.
Yeah.
So one thing you don't need to worry about is the actual air on airplanes. So
Yeah.
I was on a panel earlier this week for the Chamber of Commerce with a true expert in the air on airplanes, and I feel good about that now. But you have to worry about everything else about that trip as a potential exposure. So, there's that. But I want to just give a general set of principles. Did we talk about harm reduction already?
Not
we
today.
should.
Yeah.
Okay, so
Yeah.
look, isolation is a horrible thing for people too. I mean, we have had an epidemic of loneliness among older people coming into this pandemic. So we all have to understand that, I cannot presume to understand anybody's personal circumstances. So if it is the case that you feel like you must do something a little bit risky, like visit a grandparent, do your level best to minimize the risk, even if you can't completely expunge it. And that's an approach in public health we call harm reduction. It has, you might have heard this before during the HIV/AIDS epidemic, where we talked a lot about if abstinence isn't possible, safer sex is best. And it's a really similar sort of idea here. If you can't completely abstain from an activity because of your unique circumstances, do the best you can to mitigate your risk.
So what does that mean for flying, Lindsay? Like, how would you make a flying versus driving decision?
It's tough. And again, I don't presume to know anyone's individual circumstance, right? But like, if you have to be in a car for 5 days, that might not be, you might not be able to handle that. And I mean, I don't know if this is true because there's less traffic on the roads, but historically, flying has been a much safer way to get from place to place. And you have this competing risk of getting in a car accident. So there's so many things that we as individuals have to balance. So if you do have to fly, I will tell you the best thing to do is go to CNN.com and watch Sanjay Gupta's video of him tooting through the airport. And he actually shows you what to do with his mask. And he walks through a fake sort of airport experience. And I think that's just a really good example of harm reduction if you got to get on a plane.
We also are at this sweet spot right now where not many people are flying, and you
Right.
be on a plane with fewer people and not sitting next to somebody, but how long that will last, I think we don't know, but someone recently said, I absolutely have to travel for some family circumstance is this crazy? And I said, this might be the best time to fly. Like,
although that depends, Amanda, right? Like, so
yeah.
I lived in Chicago for 16 years and I grew up in Dallas, and a lot of those flights have actually been quite full. So
yeah,
it's a
I guess it
little
depends
bit,
your destination, but yeah.
yeah.
Well, and because
And they
fewer
cut
flights
back-
are going, and yeah.
Yeah, true. Yeah.
Minimize
Okay.
risk, harm reduction.
Harm
Reduction.
reduction. So we heard a little bit about this harm, what are the strategies for harm reduction? And I actually think it would be super helpful if folks had a framework to think through the risk of the activities that they're thinking about engaging in over the summer, as they think about trying to plan some kind of a road trip versus air travel to see family, or, so I want to just hear from each of
Amanda.
you. Yeah, what's on your list for how to think about the risks that you're taking as you make decisions?
I mean, I'll start. You guys can add, I'm sure. I think we have to, we can think about it, almost on a risk spectrum, where we know the safest thing is to stay home. That's where we cut off most of our contacts and risks, but that's not sustainable, right, in the long term, likely. And we are entering or exiting this safer at home environment to one where we have an array of choices now that we have to pick from. So how do we choose, what to do? So we've had a few great posts from our other nerdy girls this week. So I will give a plug to checking those out too. And I'll try to summarize some of those points. We can think about generally the environments that we're in, like we already alluded to, right? So being indoors in a space where you can't social distance properly and people aren't wearing masks, that's going to be a high risk environment, versus outdoors, more space between people wearing masks, right? And then when you have to make a choice about, well, I'd like to get together with some friends, then an outdoor environment will maybe be a less riskier option for that activity than having a dinner party inside your house, right? And then we can think about sort of the proximity you are to people and for how long you are in contact with people as well. So where you have those chances to modify one of those characteristics, that can decrease your risk in what you're doing. And then we can think of pooled risk. This was a topic that came up on a post this week, where if you do want to start to get together with people, choosing people who've had similar caution that they've been taking in their interactions, your pooled risk then becomes lower, right? Mm-hmm. That's a technique that we can think of. Like, I just really want to get together with my neighbors, but those neighbors have gotten together with 10 other families this week. Maybe that's not you have to think about your pooled risk in that way. And then we can think about this, I can't remember the article that was posted on this, but they talked about cumulative risk too. So like, I need to get my hair cut. Anybody see this great? I need to get my, hair done. And I also want to go see my mother-in-law, and maybe an example, so what can we do to space out those activities that we're doing over a week or 2 weeks, so that we're not clustering a bunch of higher risk activities together at the same time? And, if we do have to engage in something more risky because we don't really have a choice, then maybe waiting for a while to do that again. So you can see and watch and monitor for symptoms, to see, before you go out and maybe go into environments that you are going to potentially expose others because you had no choice but to do this other thing. Those would be some of my ideas, but you guys chime in.
I think that's great. And I'm just going to make a plug that in the spirit of amplifying female voices, Amanda was alluding to a really wonderful article in the Washington Post by Dr. Leanna Nguyen.
That's who it was.
Yeah. Highly recommended. And we did push that out on Dear Pandemic too. Yeah. Maybe, was it yesterday? All the days.
All the days.
Yesterday. And then today we put out a graphic by two other really awesome people who we would think are nerdy girls as well, right? And so that's, something we're keen on doing when we identify really solid public health messaging or science. Our goal is to elevate that to our Dear Pandemic audience and say, don't bother looking for anything else. We found it. Look at this, you know?
Great. Alison, anything you want to add on what's on your list for evaluating your risks and how to think through making these trade-offs?
Uh-oh. Is Alison?
Uh-oh.
She looks very
Alison
thoughtful.
froze. She does look very thoughtful in
Very
her
thoughtful.
frozen position, however.
That's a good frozen face.
Okay, so we just have a couple of minutes left here. We'll see if Alison can unfreeze from her thoughtful pose. But in the meantime, let me just ask each of you, Amanda and Lindsay, what's your top thing right now? Like, what's the thing you think is not getting the attention it deserves at the moment?
Great question. Amanda, do you want to go first, or?
You can go for it.
I can go
so-
if you need a minute to think about it. So I think the thing that's not getting enough attention is this, our participation in contact tracing. I talked about that a little bit earlier, but I know people kind of bounce in and out of these live streams. So I'll just reiterate that this contact tracing that is fundamental to doing outbreak control is something that it's such a huge project that it's not something the government is really equipped to handle or will be anytime soon. So I think that we as individuals need to participate in making that easier and kind of keep track of what our exposures are. And also, if you're in charge of a group situation, like a pool or a school or a workplace, you need to be taking attendance to make that process easier. So that's one of my top things at the moment. I gave you each a minute. Oh, Alison is back.
Yay, Alison.
Hi.
So my-
Alison, we're just going to close with what's your top thing right now that you think is not getting enough attention?
So I have one, if that's helpful.
Go, Lindsay.
Social contract. And this is, I think, kind of a higher level in the spirit of what Malia just offered. I have seen small business owners and community-based organization leaders be at the pillars at the forefront of establishing a new social contract with their very loyal, trusted clientele, right? And I think that we all have to build a new social contract. Like, I protect me, I protect you, vice versa, because frankly, without that, there's no trust. And we need trust to get us to safety and to get the economy started again.
Thank you. That's a great point. Amanda, what have you got?
Yeah, I think with states reopening, something that is top of my mind is, yes, part of the reason we had safer at home orders was to flatten the curve. And in many places, we were really successful at doing that. We never came close to hospital capacity. But the other piece was to give states the time to build that infrastructure for testing and contact tracing, because we have to be able to shift to rely on those tools, right? And so, I echo a lot of the things Malia said, that being intentional, and that's why we wanted to do a phased approach, because then public health experts can watch, okay, when we open up to groups of less than 10 and we have these other pieces relaxed, what happens? We have to be able to collect that information so that we understand if we have to go back into a crisis mode, how to successfully get out of it again, right? And so I encourage, I guess my thing is, I hope people rally around the value in doing this slowly and deliberately. And like you said, help contact tracers, help this effort that we're going to have to shift to as our new modus operandi for identifying and containing outbreaks, right? That there is an intentional purpose in like going slow.
Yeah, absolutely. Alison, what is your top thing?
Well, it's top of mind because I'm spending a lot of time thinking about it. But I think it's being creative about school reopening in the fall, how to help institutions of all sizes that serve kids of all ages to do that kind of radical cohorting, those tight clumps of kids, and getting them outside as much as possible. I think that's the only way we have something that doesn't just look like, my college kid in the basement doing Zoom.
Yeah, Zoom University.
Zoom, yeah.
Okay, well, it is 3 p.m. and I know all of us have Saturday activities to get back to this holiday weekend. So I'm gonna sign off at this point and thank you, each of you nerdy girls, for joining me and doing this Facebook Live. And thanks to all the viewers here for the great questions. I know we didn't get to every single question, and some of these I'm gonna write, I did already record all the questions, and some of these I'm gonna pin for full posts, and we'll try to get to them on the Dear Pandemic site, because we got some great questions and some more complex ones that I think we can cover in a top of head kind of Q&A like this. So stay tuned, and
keep
thanks so
promoting Dear Pandemic. We
Yeah,
hit 10,000
thank
followers this weekend, so
yeah,
we're
we
very
hit
excited.
10,000 followers actually just
Subscribe.
before the live.
Just before we went live.
So,
Yeah.
Get the word
Alison,
out.
I was thinking that we should give away a T-shirt or
Let's
something.
do it. I've got some. Yeah.
Yes.
Well,
All right.
I'd-
Well, maybe we'll do like some kind of a giveaway this week or something. I don't know.
Memorial Day weekend giveaway from Dear Pandemic. Thanks everybody
Those
for
of you who
joining.
did not see the matching
Yeah.
shirts, we all got branded shirts this week, so we're very excited.
Woo!
Woo!
Take care, everybody. Stay
All
safe. Stay
right.
well.
Thanks for
Bye-bye.
tuning in, everybody. Thanks, Malia.